one way of kind of thinking about autism is, imagine the most stereotypical man you could ever come up with in your head, multiply that by 100, and you're approaching what it means to be autistic, being very rooted in ideas. Ideas are what is most important, as opposed to emotions. Having a hard time being intimate, as opposed to being physical and mechanical. These are the things that people with autism struggle with, and they realize that there is something going on, because they feel this sense of loneliness, they feel this anxiety, they feel this depression. They feel this longing to be with people, but not really knowing how to do it. So one way of looking at treatment of autism is almost kind of learning how to be a part of a different culture in many ways. As a therapist, what you're really trying to do is be a cultural broker between two people, because there is nothing wrong with being autistic per se. I mean, you think of the most influential people who have ever lived. Well, chances are they were autistic. They saw the world in a unique and meaningful way, whether it's Sir Isaac Newton, whether it's Jerry Seinfeld says that he's on the spectrum, whether it's Zuckerberg, or all these tech guys. I tell you what, whoever invented the spear, chances were that guy was on the spectrum. There is nothing per se negative inherently in experiencing the world that way. It's necessary, but it does come with a cost. And so, the treatment again with autism is, like I said, is learning how to be in a different way, or at least to notice it. Whether or not a person is fully able to deeply feel their feelings, you definitely have them. Whether or not a person is able to really get and walk in other people's shoes, that the mirror neurons are there. Okay, well, we might not be able to develop that fully at all, but at the same time, we might not have to. That there is a certain level of flexibility in being able to imagine and use the autistic way of approaching the world to our advantage, to, in a sense, almost mechanically engineer these sort of experiences, to notice them, to appreciate them, to interact with them, to know what to do in social situations, to know how to relate to other people, to technically, if we can, emotionally in our guts relate to other people's experiences, to at the very least technically understand them, in order so that we can bridge that gap between you, the client, and the people around you, to sort out that sense of loneliness, to be able to get rid of that in many ways. Now, you're gonna feel different. You're gonna always be different, because you just are. But it's important to realize that just because you're different doesn't mean you are different. And what I mean by that is everybody's different. It's almost this kind of misnomer that there are people who are on the spectrum and people who are not on the spectrum. Mental health issues in general, it's less accurate to think of them as diagnoses, and more being on a continuum. And like I said, by virtue of the fact you can imagine being autistic in that sense of that stereotypical man times 100, well, that is a graspable experience we all kind of have access to. So I guess what I'm trying to say here is, we're all different, and it just kind of depends. It depends what sort of cards you're dealt with, and that might not feel better. That doesn't necessarily get rid of that feeling of loneliness, but it's important to be able to carry that with you, in the sense that, yeah, this is a challenge, but everybody has a challenge. And that doesn't take away from what you have to work on. It just means that maybe in that respect, you're not alone. And that these are gaps we can't fill.